Hi, I'm Dr. David Hill, and today we're going to be talking about severe separation anxiety in infants. So, what is separation anxiety? Well, infants become bonded to a parent, usually the one they spend the most time with or on. That tends to be mother in our culture. Now, initially, infants are not able to distinguish all that well between one person and another. But by 6 to 9 months of age, infants know very well who's a member of their family, who's mother or dad, and who's not a member of their family. And when you try and hand that infant to somebody who's not a parent, sometimes they can become very, very agitated. Now, a couple of important things to know. While that's a very common response, and baby may be very dramatic in the response, there may be a lot of crying and screaming involved, you're not going to do your baby tremendous psychological damage by handing him or her to somebody else. They really are going to recover from that transition. What you might do is also give the baby a transition object, something that reminds him or her of clothing that you've worn, something that smells like you. It could be a favorite toy. Now look out for choking hazards on this. You don't want it to be, for example, a scarf that could wrap around their neck, or an animal that has little plastic eyes that could fall off, or something with buttons on it that could fall off. So be careful what you choose. A nice soft t-shirt is often a good choice. Know that that baby really will adjust to the situation. Now, one thing that I hear a lot of is don't hold your baby too much. You're going to spoil them. They're going to get used to you. Don't worry about that. If you want to hold your baby, hold your baby. They're not going to get spoiled. That bonding between the infant and the mother is a really important process. And don't worry that you have to discipline your baby by putting him down. That said, also don't feel tremendously guilty if you do have to hand your baby to somebody else and walk away or put him or her in daycare. These things are not traumatic and the child really will survive. Talking about severe separation anxiety in infants, I'm Dr. David Hill.